A follower sent me this message and I have selected it to be addressed in a comprehensive manner in today's video amongst the many other questions and inquiries that we received. So thank you and sit back and enjoy, because as always, this can be a life-saving video for you or someone in your circle. Welcome back to those who are returning to this page, and for those who are new, this is Success Clinic and I am Dr. Pokwola. Do me a favor to follow and subscribe to this page so that we can continue to grow our international community of healthy and brain healthy people. Now, selecting the appropriate anti-epileptic medication is a critical aspect of managing epilepsy. The choice depends on various factors, including the type of seizures, the patient's characteristics, potential side effects, and individual responses. And at the end of this short video today, you will have a clear and comprehensive understanding of how healthcare providers determine the most appropriate anti-epileptic medications for patients with epilepsy. Above everything, the most critical initial step in selecting your anti-epileptic medication is obtaining a precise and perfect diagnosis. Unlike the common understanding, there are several types of seizures, and different types of seizures may require a distinct treatment approach. If you would like to know more about this topic and the different types of seizures, including one that your child, yes, your child, may have had for several years and you do not even know. That's right, you may not even have known about it. Let me know in the comment section below or send me a direct message. Now, with that said, comprehensive tools for epilepsy evaluation and diagnosis include EEGs, imaging studies, and thorough medical histories that include a detailed description of the physical presentation observed whenever the patient has a seizure. Now, this will help your doctor to understand the nature and origin of the seizures. Now, it is very important to know that anti-epileptic medications are tailored to specific seizure types and epilepsy syndromes. Focal seizures may be treated differently with different medications than generalized seizures. Now, identifying the specific epilepsy syndrome will incredibly guide your doctor's medication choice and promote optimal efficacy. Another critical factor is identifying the patient's characteristics. Patient-specific factors play a crucial role in medication selection. Things like your age, your gender, your overall health, and coexisting medical conditions will influence the choice of your anti-epileptic medication. For example, certain medications may be suitable for pregnant women or those who have liver or kidney conditions. Now, side effect profile is another important factor. Let me tell you the secret. Every medication you take and every medication you put in your mouth has a side effect. That's right, even Tylenol, that some people call paracetamol or acetaminophen, has major side effects. Every anti-epileptic medication has a unique side effect profile. Some common side effects include drowsiness, dizziness, weight gain, or mood changes. Now, choosing a medication with a side effect profile that is compatible with your lifestyle and health status will significantly enhance your treatment adherence. Your doctor will also put drug interaction into consideration when choosing your medication. Most commonly, patients who are dealing with epilepsy are simultaneously battling with comorbidities such as psychiatric issues, among others. Now, it is particularly important that if a patient's epilepsy is caused by brain tumor or traumatic brain injury, the patient would most likely be dealing with other medical conditions requiring medications that may interact with the metabolism of your anti-epileptic medications. Therefore, very careful assessment of potential interactions with your medications is essential in selecting your anti-epileptic medication. If not carefully considered, such errors may impact efficacy and cause severe adverse effects. Now, you need to give your doctor a complete list of all your medications for your doctor to put into consideration to minimize potential complications. Regular follow-up and communication between you and your doctor is very important to help to optimize your treatment plans. Now, because the patient's preferences and desires should always be at the center of all medical decisions made, your profile and psychosocial factors play a critical role in medication adherence. parents. This is why your doctor should engage you in shared decision-making process and consider your preferences before choosing your medication. For pregnant women, very importantly, certain anti-epileptic medications are teratogenic. In other words, they can cause significant birth-related defects in the babies by interfering with the cell division process that leads to the transformation of the fertilized zygote into the full-blown baby. One of such critical teratogenic effects is the formation of spina bifida. This often occurs because certain anti-epileptic medications may deplete your systemic folate levels, which are critical catalysts for cell division and fetal development. More on this in a different video. But to summarize, for women of childbearing age, the potential impact of anti-epileptic medications on pregnancy is a critical consideration. Some medications may pose this risk, and you need to discuss this with your doctors. Now, one critical factor is cost and accessibility. The financial aspect of treatment cannot be overlooked. Just like the question sent to me, the cost of epileptic medication, especially in countries with much limited access to the medication and lack of resources for production, as well as the cost of the medication, is of critical importance to ensure that the patients can afford the medication and can consistently obtain the prescribed medication. So to answer the question that was sent to me, while I understand that the cost of Keppra, which is also known as levetiracetam, and Epilim, the generically called valproate, may be high, they are two of the most effective anti-epileptic drugs and most accessible. Now, changing any of these medications will require you speaking with a neurologist who is currently managing your brother's condition, who will need to put all of these above mentioned factors into consideration to decide if a more accessible, affordable, or perhaps lower doses of the current medications can be used to control your brother's presentation. Now, to wrap this up, and in conclusion, choosing the right epileptic medication is a complex process that requires a thorough understanding of the patient's medical history, seizure type, and individual characteristics. Healthcare providers must consider a combination of factors like we've mentioned, including side effect profiles, drug interactions, and patient preferences to create a personalized and effective treatment plan. Regular monitoring and open communication between the healthcare provider and the patient are key in achieving optimal outcomes in epilepsy management. Now, if you find this video and any of our other videos helpful, please let us know in the comment section so we can know that the efforts put into these videos are not in vain and that some lives are being saved. Also, subscribe and follow this page so we can build a great community of healthy people. Please turn on your notifications so that you will not miss any future videos. Now, lastly and very importantly, do not forget to share this video on your pages, your stories, your chat group, or send it to someone who you know may need these health tips. You will be surprised of someone who is suffering in silence that you may send this video to, that this will be life-saving for. And until the next video, thank you for watching. This is Success Clinic and I remain Dr. Popola. I'll see you in the next video. God bless you.